This video describes gamma knife surgery at St. Joseph's Hospital and Medical Center and what you, as a patient, will experience before, during, and after treatment. Gamma knife surgery is a well-established treatment method used to treat selected neurological diseases. Gamma knife is not a normal knife. The doctor makes no incisions. Instead, precisely focused beams of radiation are directed to the treatment area. Gamma knife treatment is painless and allows you to quickly return to your normal routine. More than 50,000 patients undergo gamma knife treatment each year. The method has been in clinical use since 1968, and there are more than 250 Lexcel gamma knife systems in operation around the world. Gamma knife surgery is a unique method that delivers extremely focused radiation beams to a target area in the brain. Your head is positioned inside the radiation unit. During treatment, all radiation beams meet at a focal point with sub-millimeter precision. The individual beams are too weak to damage healthy tissue on their way to the target area, but are very powerful when they merge at a single focal point. This can be compared with the principle of a magnifying glass in the sun. Through small, pre-programmed movements of your head into different positions, the shape and dose of radiation is optimized to affect the target without damaging the surrounding healthy tissue. In most cases, a single treatment is given. This will involve 4 main steps: attaching the frame, imaging, treatment planning, and the treatment itself. A specialized team takes care of you throughout the entire procedure, and you are, in most cases, awake at all times except for brief sedation during frame placement. Before treatment, the procedure will be discussed. To begin, a lightweight frame will be placed on your head. Your hair doesn't need to be cut or shaved. Brief sedation is administered by an anesthesiologist. Local anesthetic is also applied where the frame will be attached. Once the anesthetic has taken effect, the frame will be attached to your head with 4 pins. The frame remains on your head throughout the entire procedure to keep your head in a stable position during imaging and treatment. Attaching the frame takes about 15 minutes. A coordinate box is used during imaging to provide reference points on the images for the treatment plan. After the head frame is in place, it's time for imaging. Some examples of imaging include MRI, CT, or angiography. Although these imaging studies may have been done before, they need to be done again with the frame on to determine the exact location, size, and shape of the target. After imaging, the coordinate box is removed. The images are now transferred to the treatment planning computer. Once the images have been taken, you can rest while the doctors and a radiation physicist develop your treatment plan. Each treatment plan is unique and individually designed to address your particular medical condition. Specially designed treatment planning software assists the doctor in preparing the treatment. For security, the final plan is rechecked and approved. Once the treatment plan is complete, the actual treatment can begin. Before starting, the doctor will explain how long the treatment will take. You will lie down on the treatment couch and the head frame will be attached to the patient positioning system, which automatically moves your head during treatment. The number of small movements depends on the shape and location of the target. We will try and make you as comfortable as possible during treatment. The treatment is silent, totally painless, and will usually last 30 to 90 minutes depending on the exact size and shape of the lesion being treated. During the treatment, you will be fully awake and you will be able to talk to the doctor and nurse through an audio-video connection. Our team is here at all times to assist you. Once treatment is completed, the frame will be removed. You will be observed for an hour or so after the frame removal. Some patients will experience a mild headache, minor swelling, or numbness over the back of the scalp, but most report no problems. Occasionally, medications are given to assure comfort prior to discharge. The doctor will inform you if an overnight stay is needed for observation. You should be able to return to your normal routine in a day or so. The doctor will stay in contact with you for periodic follow-up and consultations. The effects of the treatment will occur over time. Radiation treatment is designed to stop the growth of tumors or lesions, which means the results will be seen after a period of months or even years. Gamma knife surgery is a well-established, non-invasive treatment method which allows patients to quickly return to normal routines. The guiding principles of gamma knife surgery are, and will always be, clinical effectiveness and patient comfort.